Well, after all the adhesion and the rubber dam isolation steps, let's talk about a different practical steps. The cavity design. I call it the hidden quality of restoration because after some composite restorations, it is very difficult to spot to identify the cavity border because the tooth shade colors, tooth shade composites directly cover the restoration cave or surface. So we should be careful when we are designing our cavities. For example, in this case, if we leave the unsupported enamel and also irregular cavo surface, it is very difficult to have durable restoration, and there may be some leakage in time because of the fracture of thin enamel which placed on the cavo surface. And we can say a well-finished cavity preparation enables the restorative composite to adapt well and providing a good marginal seal to the direct benefit of the clinical lifetime of the posterior composite restorations. And there are some different way to smooth and to make a precise cavity borders, cavity cavo surface, and you can use tungsten carbide burrs, also the composite polishing disc that you see here. Actually, mainly we should clean the irregular areas and we should have regular and supported cable surface that you see in this picture. And also isolation is the other matter because under the rubber dam, it is very easy to have visible work field. And in that way, we can work easily and more comfortably because of the rubber dam contrast of the rubber dam isolation. And let's talk about how we can have supported and good cavity surface. Actually, we should remove the unsupported enamel, and we have different ways to do that. Firstly, tungsten burrs are very useful, and also we can use diamond burrs to smooth the cable surface. I don't mean beveling when I'm telling the smoothing, just I mean the cleaning of the thin enamel remainings on the cable surface. And also we can use composite polishing discs to remove the unsupported enamel. And let's watch how we can do that. There's some enamel remainings on the distal buccal surface of the number 5, and I'm using electric handpiece with very low speed. Now I have more precise cavity borders. Also, we not only use burrs for the cleaning of the remainings, we can also use ultrasonic burrs. For example, when we are working on the mesial or distal side of any cavity, we can use ultrasonic bursts. And also, this kind of one-sided ultrasonic bursts, the only one side is active, the other side is polished surface, and so thus you can protect the adjacent tooth. Especially, it is very useful for the proximal preparation, even if you are doing direct or indirect restoration, it doesn't matter. And I really love to use that. And also, before any kind of direct or indirect restorations, we must arrange the adjacent tooth contact. Otherwise, we may, after the restoration, we may encounter with some patient complaints like food infection. This time you can use EVA handpiece, and it's working different when you compare with the other handpiece. It's working vertically, not rotation movement. So it's very useful to polish the somewhere, especially nearby the rubber dam clamp, because it may be difficult to reach the rubber dam clamp border when you are doing some polishing steps. And let's look how it works. Aesthetically, when you look at the top of the video, it's working directly vertically. I'm just cleaning the composite remainings and making polished and more anatomical surface. And when you compare with the left photo and right photo, you can see that on the right side, the surface, the contact point is more anatomical. And also, before the restorations, we should have clean surface. For example, if you try to make an adhesion here, it is very difficult because some discolorations, maybe some plaque remainings, periodontal plaques. So it is very difficult to have good adhesion. And I believe that if you were an adhesive, you would prefer to stick. You wouldn't prefer to stick that kind of surface. You would prefer to stick that kind of surface. So before the composite or any resin cementation, any resin or any cementation, you should clean the surface of the tooth. And we talked about the ultrasonic tips. Let's get into deep related to ultrasonic tips. What kind of tips we have? Actually, I mostly use that kind of one-sided passive ultrasonic tips, especially for the proximal area. And they are also useful when you are working on the edge of the rubber dam. Here, when you try to work with the rotational hand pieces, it may be difficult to work there because of the tearing of the rubber dam. So ultrasonic tips are not working as a rotational movement. So you can protect the rubber dam nearby the cavity border, especially for deep cavities. And also they are very useful for the surface that difficult to access. It's the number 7 tooth, second molar tooth, and there was a distal caries here under the intact and enamel, some enamel surface. So you have two options because it is very difficult to reach there by using other hand pieces, and you must remove the occlusal enamel to reach that kind of cavities. And ultrasonic tips have very long neck, and you can easily reach to that kind of areas. And then after creating the cavity, then you can fill the restoration, and it is the final of the restoration. And also, uh, it's very important that we talked before. It's very important to arrange the adjacent tooth, and also it's very important to protect the adjacent tooth as well. For example, there was a composite filling here on the number 5, and uh, on the patient's former treatment process, I think there was the other person created an iatrogenic problem on the mesial side of the number 6, and there is a small concavity on the mesial side of the number 6, and before that kind of restorations, we should uh, arrange the adjacent tooth proximal surface. And I just use composite polishing strips, and then we can use again the ultrasonic burrs. And especially for that kind of cavities, the one-sided passive or one-sided ultrasonic burrs, they are very useful. They are very safety when you compare with the rotational hand pieces or any other burrs. And especially if you are not working under magnification, it's very difficult to protect the other tooth. And also we use ultrasonic burrs to remove the screwed posts, that what you see here. After cleaning around the screwed post, just you are using the ultrasonic burst anti-clockwise. And if you are lucky, you can do it. But mostly you can remove it by using the ultrasonic burst. And also air abrasion is the other steps for the cavity. Actually, there are some different lectures, there are some different articles about this issue, but I can't say that there's a consensus about that. But there are some articles about if you clean the dirty surface with the uh, aluminum oxide particles, you may have more clean surface, more cleanable, more the we can cut here, please. And you can use air abrasion for the before the restoration. But to be honest, there is no consensus about this issue. But it's better to use aluminum oxide before the restoration because they clean the surface very easily, and you can have very cleanable surface, and it's very good for the adhesive. And let's look how I manage the process after the cavity preparation. There are two options to clean the surface. If you are using Aqua Care, the company have 29 micron sized aluminum oxide particles, or you can use 50 micron aluminum particles. But you shouldn't leave or you shouldn't apply the aluminum particles for a long time on the surface because they are removing some to structure. If you leave them more, maybe you can open a cavity on the surface. Just I'm cleaning the surface for the three between the 3 and 5 seconds. That's all. And after all the surface arrangement, all the cavity preparation, then we can start the adhesion, we can start our restoration. And before the restoration of the class 2 cavities, we should have good metric systems. There are lots of different metric systems in the market, and we should be careful when we are selecting the correct size. Actually, the main problem related to metric systems, the forming of the proximal area, proximal anatomy, and especially because of the Toffel-Mayer system, you may sometimes create very straight proximal area, but the contact surface should be located at the center point of the proximal area. And especially for that kind of restorations, if you have over contact point here when checking the occlusion after restoration, and if you remove uh, from the top of the composite restoration from here, after that you may encounter with the gap between the restored and adjacent tooth, and the patient may visit you again because of the food infection as well. So we should locate the contact point on the center of the proximal area, and also we should create a more anatomical surface. When you check the line here, it's more curved anatomy, and when you compare with the Toffel-Meyer system, they create very straight and non-anatomical contact point. And let's talk about the different systems, proximal uh, arrangement, the different systems proximal anatomy. You can use polydentous sectional matrix system or Garrison or Polydent. There are lots of different ring system for the sectional matrix, and they mostly give the similar result. The important point is also ring system and also the matrix band. And here, when you place the ring and the matrix band, you can create the more anatomical surface. And also, if you are using a Paludan sectional matrix ring systems, you can still have the similar contact point. But when you are using Tor sectional matrix or any other sectional matrix, they have very thin tip, and they may stuck into between the two teeth, and here you may create a gap before the restoration. So it's better to have to modify their tips, or they have their own silicone tips, but I prefer that way because before the cavity preparation, you can use gingival barrier to copy the buccal and lingual anatomy of the surface. In that way, you may create the same buccal and lingual anatomy and proximal contact point. And before the restoration, you are applying gingival barrier here, and then you are placing the sectional matrix ring, and again you are applying more gingival barrier. Then you are directly curing it, and you can have a modified custom sectional matrix ring, and you may create similar results and very good results in that way. And also the other matrix systems are Kerr Metafix, and it is very useful for the periodontic patients, especially for the primary tooth, because you are just pushing on the center of the system, and it directly adapt the cavity wall to wall. It's very useful for the primary tooth, but sometimes, to be honest, it's a bit difficult to create the good contact point. And also the supermod metric systems, they are very useful for the IMODI, especially for the three-sided cavities. And I still use them, but especially for the deep margin elevation, I mostly use that kind of metric systems. And when it comes to Toffel-Meyer, I think it's a bit old school metric systems when you try to finish all the restoration, but they are, to be honest, lifesaver for the deep margin elevation. But when it comes to for the final restorations, it's a bit difficult to create anatomic surface, anatomic contact points. And also BioClear system gives you very good quality and very good anatomically formed matrix plan. And especially when you check from the proximal buccal side, you can directly see that their contact point located on the correct point mostly, but it's a bit thicker matrix bands when you compare with the metal one. So you must use a good quality of a ring system to make some separation between teeth and the adjacent tooth and the restoring tooth. Otherwise, after you remove your matrix band, you may encounter with a small amount of gap between the teeth. So it's very important point for me. And it's how I treat the class 2 cavities basically. If I have class 2 cavities like you see in that photo, I mostly convert the class 2 cavities into the class 1 cavity by closing the proximal area by by making the creating the proximal area, and then I can go on by doing like it's a class 1 cavity, and that's a final result. And when it comes to deep cavities, uh, it's still very useful for the three-sided cavities, and you can place two different ring system, uh, both mesial and distal side. And after making the class 1 cavity, after converting it into the class 1 cavity, you can do that like it's a class 1, and it's the result. And also the other after the ring system, I want to talk about the a bit related to matrix band styles. I think you may know there are two different type of sectional matrix systems, and one has uh, a bit thinner, a bit thinner, narrow bottom area, and the other one has the left-sided photo has the a bit wider bottom section, and actually they both solve the class 2 cavity problem, but in some extreme cases you can see what's the main difference and what's the main advantage of that kind of matrix bands. And let's check how it works for the deep marginal elevation. In this case, we collect all the caries, but the cavity lines, cavity border was going under the under the subgingival area, and it's very difficult to isolate that uh, location because of, especially when you are using rubber dam clamps, it is very difficult to place the matrix bands. And when I placed the narrow matrix system, I couldn't cover all the proximal surface. But when you use a wider matrix bands, it might be very useful to cover all the proximal area. And then I am using Teflon tape to adapt well. I call it Teflon tape wedging technique, and especially for the deep marginal elevation, it is very useful. And then you can elevate your margin without any surgical steps. And after etching and adhesive process, you can directly elevate the margin. Actually, for that kind of cavities, I mostly prefer to make firstly lingual or buccal side, and that's the final of the deep marginal elevation. Then you can do direct restorations, or also if you are planning to do indirect restorations, you can do that as well. And deep margin elevation, that's what you saw on the last video. Deep margin elevation allows you restore the tooth without any extra surgical process. And if you can isolate the tooth, isolate the subgingival area, then you may elevate the margins by using the composites. But the important point is you must have very strictly isolated area, extremely isolated area. Otherwise, it doesn't work in time. Maybe it works 1 or 2 years, but in time there will be some leakage, and it will be directly decrease your success. And it's what you can do that. You can use different system. I can't say that there is just one solution for the deep margin elevation. It is totally depends on what you have. There are some deep margin elevation matrix bands, and also you can use the Toffel-Mayer matrix band by cutting them, or sectional matrix band, but what you saw on the last video. But the important point is you must have very extremely isolated area. Otherwise, you can't be successful. And after that, you can do direct or indirect restoration, especially for that kind of tooth. There wasn't the adjacent tooth, and after placing the rubber dam clamp, you can see the mesial side of the tooth, and the cavity border is almost nearby the bone level, and it's very difficult to isolate that kind of cavities. And here, I again used the wider sectional matrix band, and I stuck the Teflon tape again. That's what you see here. And the Teflon tape wedging is very useful way, especially for the that kind of tooth. And let's see how it works in reality. I cleaned the proximal area of the deep cavity. It's almost under the subgingival area. And after placing the Kerr Supermat matrix system, I just using the Teflon tape to adapt my matrix band onto the proximal surface of the tooth. And then you can elevate the restoration. And also we can use other different matrix band, especially for the saddle matrix bands are very useful for that kind of deep cavities, and it's almost again on the bone level, and it's very useful to elevate the margin. And they also have the more anatomical surface, more anatomical structure. And also we can use ivory type matrix band, but for that kind of marginal elevation, to be honest, you shouldn't finish all the restoration from bottom to top by using just one matrix band, because doing the when you are doing the deep margin elevation, it's very difficult to keep the formation, keep the structure, or keep the anatomy of the matrix band, and you damage when you are placing it for on the deep areas, and especially on the center of the matrix band, you may create some convexity or concavity because of the some uh, deformations. Well, especially for deep margin elevation, after I make the first layer, after I elevate the margin, I change my matrix band and I place another one. And also the other way is the matrix in matrix system. There's a very deep concavity on the mesial side of the number 4. And when you try to place any matrix band, it's very difficult to have that kind of anatomy. But when you place another matrix into your the the super mathematics or other metric system, when you place the small amount of matrix band and when you stuck between the matrix bands a Teflon tape, you can do you can have very super isolated proximal area. So that's the reason why I told you I can't tell you just only way we have to isolate the deep margin elevations. We can do it in different ways, especially for the extreme cases. But to be honest, I can tell that the important point is we should have a lot of different gun with uh, when we are doing some extreme cases. And also, after placing the matrix bands for the class 2 cavities, when you are using magnification or if you are taking photo, you can directly see that kind of small amount of rubber dam. But if you don't using magnification, to be honest, it's very difficult to spot that kind of areas, that kind of leakage areas. And after you finish your restoration, maybe your patient may apply you again after 1 year, after 2 years because of the leakage. So it's very difficult to adapt the matrix band on the proximal side of the tooth. That's the matter. And after you place the ring system, you will have that kind of small gap. And we are using that gap for the wedges. There are different wedges in the market, the plastic one, the wooden one, the silicone one. But my favorite is the that Polydence wedge. They don't tear the rubber dam. They are working very well. But when you compare with the wooden one, their separation ratio is lower than the wooden one. And after placing the wedge, you can directly close the proximal gap. But the important point when you are placing the wedge, you should be careful because you must select the correct size of the wedge. Otherwise, you may damage the matrix band. Just I want to show you here when you try to place the a bit wider, a bit larger vats, you may directly destroy the matrix band here. So it means you must replace your matrix band, and especially after the outing of the weights, you may encounter with the bleeding. It's very overwhelming issue, very challenging time. So we should be careful when we are selecting the weights, and after placing the correct size, we don't encounter with any problem because we want to have the normal anatomy of the matrix band before the restoration. If we have that kind of damaged and deformed matrix band, you will directly you will restore the tooth by following the surface of that matrix band, and it's very difficult to have anatomic surface. So the wedges are very important section. And the other wedges are wedge guards, and which includes small amount of matrix system on the top of the wedge, plastic wedge. They are very useful to protect the proximal proximal tooth, and it's how it works, especially when you are making a small cavities. When you place that kind of wedge guards, it is very useful to protect the adjacent tooth. I feel more comfortable. but still they are very thin layer of matrix bands. Still, you must have be careful when you are doing that process. But they are protecting the tooth from the effect of very small touching uh, of the uh, fast speed handpiece, air turbine, or and maybe you remember that case. There was a small concavity on the mesial side of the tooth, just because of not protection of the proximal area adjacent tooth when they were doing cavity. And after protecting the adjacent tooth, we can start after the placing of the matrix band, we can start to do our cavity base, because we already learned the adhesion process of the restoration. Actually, I mostly use flowable composites on the bottom of restoration, because when you're preparing the tooth, you are creating very small voids, very small gaps by using your diamond burrs. And it is very difficult to have a good condition, to have a flat surface on the tooth base. So the flowable composites directly close that gaps, and they create lower, more flat and condensable base for the posterior restorations. And after the base, we can directly finish our restoration. And also, how clean surface should we have? There are affected and infected dentin surface when we are doing direct or indirect restoration. When we get into the dentin surface, we will encounter with if affected and infected dentin surface. There's a caries indicator dye, and you can use caries indicator dye to stain the affected and infected dentin as well. And they not only stain the affected infected dentin, they also stain the affected dentin, because they stains the organic matrix of less mineralized dentin surface. And also, these dyes are very useful to detecting the cracked lines. Maybe you remember it from the diagnose steps. It's another extreme diagnostic method, especially for detecting the cracked lines. And also, after cleaning the amalgam mercury fillings, or other fillings, or without any fillings, there may be some caries. After cleaning the caries, we can directly apply the enamel and dentin surface, and when we wash it, rinse it, there will be some green or red. It depends what brand you're using. Uh, so we will encounter with that kind of green or red colors, especially on the dentin enamel junction. We must have very clean dentin enamel junction, and if we have clean dentin surface, it means we can have a high shear bone strength after application of the adhesive. So after all the restoration steps, I want to mention about the peripheral seal concept. It is combining anatomical measurement and pathological and histological knowledge with caries detecting dye. And there are lots of different uh, ways to detect the caries. But in the peripheral seal concept, it tells that if you have totally cleaned dentin enamel junction, you can directly seal all the dentin surface, all the base area, even if there are still some bacterial carriers. In the peripheral seal, you must clean the all dentin enamel junction, and in that way you can directly have very isolated, very good sealed restoration, even if you are doing direct or indirect restoration. Because when you compare with the shear bone strength of the different dentin layers, on the healthy dentin, you will have the best shear bone strength. When it comes to affected dentin, on the affected dentin, there is no bacteria, but the color is the dentin, and the mineralization of the dentin is different when you compare with the healthy dentin. And because of that mineralization, the collagen fibrils are changing, and the structure of the collagen fibrils are changing, and it's directly affect the adhesion of the surface of the dentin. And that's the reason why affected dentin has lower shear bone strength than healthy dentin. And when it comes to infected dentin, it's the lowest shear bone strength layer of the dentin. So because of there are some still bacterial area, and also the collagen fibrils are totally destroyed, almost totally destroyed, and it is very difficult to have a good quality of the hybrid layer. So that's the reason why we are doing peripheral seal concept. If you have affected dentin, that's what you see here. If you have affected dentin, it means that you may have lower shear bone strength. And in the peripheral seal concept, you should clean that point to seal all the cavity base, cavity floor. And that's what we tell. So when we are doing the cavity, when we are preparing the cavity, we should clean all affected dentin nearby the dentin enamel junction, and totally clean dentin enamel junction ensures good seal restoration.